Hello, thank you for joining us for the fiscal year 2026 National Technical Assistance Program's Technical Assistance presentation. I'll refer to National Technical Assistance Programs as NTAPs for the rest of this presentation. My name is Kayla Miller, and I'm the lead analyst for the NTAP team in HRSA's Bureau of Primary Healthcare. During this presentation, I will provide you with information to help you complete your NTAP application. We will post a recording of today's presentation along with the slides on the NTAP Technical Assistance webpage in about 1 week. Colleagues will join me to answer your questions at the end of today's presentation. We'll be answering questions that have come to us through the BIPID contact form, as well as ones you submit through the Q&A pod. Unfortunately, the Q&A pod does not work correctly for mobile devices, so consider joining us on this call on a laptop or desktop computer if you would like to ask questions. We are also having some technical difficulties, so our camera will be off for the duration of the meeting. The NTAP NOFO is your primary resource for understanding how to apply for NTAP funding. To access the NOFO, visit the NTAP Notice of Funding page on grants.gov. You can get there from the NTAP Technical Assistance TA webpage. Once you are on the NTAP Notice of Funding page on grants.gov, click on the Package tab, select Preview, then Download Instructions. Before we dive into the NOFO details, Jim McCray, Associate Administrator of the Bureau of Primary Healthcare, would like to share some helpful context for this NOFO. Welcome, Jim.
Great, thank you so much. And thanks everybody for joining us today. As I usually say on these types of calls, good afternoon or good morning to those out on the West Coast. Again, thank you so much for joining us. I am Jim McCray. I'm the Associate Administrator for the Bureau of Primary Healthcare, and we are here to talk about the National Technical Assistance Program funding opportunity for 2026. But before we get into the details, I do want to just send out a big thank you to all of our previous NTAPs who have done amazing work over many, many years. I've had the privilege of working with our National Technical Assistance partners, National Cooperative Agreement partners for many, many, many years, and their work has been exceptional. They have done outstanding jobs to help improve the services that health centers provide. They have helped people join the program. They have done many things on a quality standpoint, just a variety of different activities. And I just wanted to take a moment to personally thank them for all the amazing work and the thousands and thousands of hours that have been devoted to improving the quality of care and the experience that our patients have at our nation's health centers. So big shout out and thank you for all your incredible work. As you have probably seen by now, however, and this webinar will focus on it, there have been some changes that are being made to the NTAP guidance. The guidance itself is actually changing its name. We are now calling this the National Technical Assistance Program to really put a focus and an emphasis on technical assistance to health centers. We also have changed the period of performance. So similar to what we have provided to our health centers, we are moving from a 3-year project period to a 4-year project period. That really helps align with the current project periods for our health centers. A couple of things that haven't changed is the amount of money that's being provided to the NTAP program is remaining relatively the same. In fact, it went up just a little bit to $24 million on an annualized basis. And we are continuing to focus on providing strong technical assistance and support to our health centers. But what you may have noticed also is that the number of awards has changed. We are going from where we used to fund 22 organizations to now 3 national organizations. Each of these awards, applicants can apply for up to $8 million to support a wide variety of activities. You'll also notice that we have closely aligned this notice of funding opportunity to the health center program statute, specifically section 330L. It is very much aligned with our authorizing statute. We've also consolidated the technical assistance into 3 primary areas, which again, you'll hear more about in a couple of minutes: clinical and preventive excellence, operational excellence, and national technical assistance and coordination center. You're also going to note a different focus in terms of what we're asking applicants to do for this year and for the next 4 years. Required activities now include what we're describing as really high effort, high reward, outcomes focused cohorts. Through these cohorts, NTAPs will help health centers improve their performance in several priority areas, including hypertension, nutrition, and healthy weight for kids and adolescents, as well as financial and operational performance measures and leadership support, very much in alignment with the Make America Healthy Again agenda. Through these NTAP awards, our goal is to maximize the impact of the health center program, again, to deliver the highest quality care to more than 32 million patients served by our health centers every year. One of the other things you'll see in the funding opportunity is we are encouraging collaboration. So the number of tasks as well as their complexity, we are encouraging folks to look for opportunities to collaborate with one another to provide the best quality technical assistance program, again, for our health centers all across the country. Again, this is a big change. We wanted to make sure that folks had adequate time to develop applications. So we've given 90+ days for organizations to submit those applications. We anticipate a large number of applications coming in for these 3 technical assistance programs. So we anticipate that it will likely be very competitive. And we wish you all the best in terms of those applications. So with that, I'm going to say again, thank you for your interest in our program. Thank you again for your support of the Health Center program. And for those who were previously NTAPs, thank you for your service. And we look forward to our new future working together. So with that, I'll turn it back and we'll jump into the content of the webinar today.
Thank you so much, Jim.
Thank you.
So now I will go ahead and jump into the agenda. During this presentation, I will provide an overview of the NTAP funding opportunity, highlight some details for developing your application, summarize the reporting requirements and other considerations, review the technical assistance resources available to you, and finally, answer your questions. To begin, we will start with an overview of the NTAP NOFO. NTAP is a competitive funding opportunity. The purpose of the funding is in the name, National Technical Assistance Programs. The NOFO will fund organizations to provide national technical assistance to health centers. NTAP award recipients will develop, deliver, coordinate, and evaluate this technical assistance, or TA for short. NTAPs will support health centers to deliver comprehensive, high-quality primary health care, improve chronic disease management, nutrition, and preventive services, improve operational effectiveness, efficiency, and quality, address emergent public health needs and priorities, and meet and exceed compliance with the health center program and supplemental funding requirements. NTAP TA activities cover 7 health center performance domains. A link to the Health Center Performance Improvement Framework is on this slide. Visit the Framework TA page to learn more about each domain. We plan to fund 3 awards of $8 million each. The period of performance will be 4 years, from August 1st, 2026 to July 31st, 2030. This slide lists the types of domestic organizations that are eligible for NTAP funding: nonprofit and for-profit organizations, public entities, institutions of higher education, and Native American tribal governments and organizations are eligible. Individual and foreign organizations are not eligible. The information and documentation in SAM.gov will be used to verify your eligibility. Make sure your SAM.gov registration is active. While many types of organizations are eligible to apply for NTAP funding, there are some important considerations. We will award NTAP funding in 3 categories: clinical and preventive excellence, operational excellence, and national TA and coordination center. You may only apply for one of these categories. If you try to apply more than once, only your last application submitted by the deadline will be considered. We are looking for applicants that can hit the ground running and start providing TA within 60 days of award. Your application must demonstrate your understanding of National Health Center TA needs, show your experience with and ability to conduct learning opportunities for health centers, explain how you will identify best practices that improve your TA, and identify organizations that will provide subject matter expertise. NTAPs are required to provide various types of TA to improve health center performance. All NTAPs will use the first two TA formats to support health centers. The final format is particular for NTAPs focused on clinical and operational excellence. National Audience TA is general, short-term, and didactic. It addresses the priority needs of many health centers. An example is a webinar. National Community of Practice, also known as COP, TA, includes regular interaction of small groups and peer learning to address a particular topic and area of need. Communities of practice run for one budget year and include at least 6 sessions. Outcomes-focused cohorts offer intensive, targeted one-on-one support and peer learning for health centers to improve their clinical or operational performance. The NOFO provides requirements for these high-effort, high-reward cohorts, but in general, each cohort must include at least 40 health centers. Cohorts will work together for 3 years. HRSA will help establish the cohorts with letters of commitment from participating health centers due within 6 months of award, and you'll need to retain 90% of your cohort members from year to year. More information about the TA formats is in the Program Requirements and Expectations section of the NOFO. This slide lists the annual requirements for each NTAP category. For both the clinical and preventative and operational excellence NTAPs, you are required to complete at least 36 activities across 13 objectives each year. 22 of those objectives must be national audience activities. You'll also run 8 national communities of practice and 6 outcomes-focused cohorts each year. For the National TA and Coordination Center NTAP, you are required to complete at least 36 activities across 8 objectives each year. 18 of those activities will be national audience activities. You will also run 12 national communities of practice each year. These communities of practice will focus on developing health centers, leadership, and governing boards. Each of your national communities of practice must include leadership from at least 12 health centers. Since 18 plus 12 only gets you to 30, you'll get to choose the format for 6 annual activities. For more information about annual requirements, refer to tables 2 and 3 in the NOFO. In your application, you must propose plans to achieve the objectives based on your NTAP category. Over the next few slides, I'll highlight a few objectives for each NTAP category, but please refer to tables 4, 5, and 6 in the NOFO for the full list of required objectives. The Clinical and Preventive Excellence NTAP includes objectives related to improving access to comprehensive primary care, improving chronic disease management, improving preventive services, and outcomes-focused cohorts to improve clinical performance. You'll run 6 outcomes-focused cohorts, as I previously mentioned, and of the 6, 2 must focus on hypertension, 2 must focus on weight assessment and counseling for nutrition and physical activity for children and adolescents. You may choose the topics for the other 2 cohorts from a list of 5. The Operational Excellence NTAP includes objectives related to increasing workforce recruitment, retention, and development, improving financial and resource management, improving health information technology and data management, and outcomes-focused cohorts to improve operational performance. Similar to the clinical and preventive excellence NTAP, you'll run 6 outcomes-focused cohorts. Of the 6, 2 must focus on staffing and utilization, and 2 must focus on days cash on hand. You may choose the topics for the other 2 cohorts from a list of 4. The National TA and Coordination Center NTAP includes objectives related to developing and conducting a national TA needs assessment, national communities of practice focused on health centers leadership and governing boards, facilitation and information sharing among HRSA-supported TA programs, and maintaining and adding to the Health Center Resource Clearinghouse. As a reminder, tables 4, 5, and 6 in the NOFO list all the objectives and measures for each NTAP category. Now I will provide some information to help you develop your application. To do business with the federal government, including applying for funding, you must be registered with sam.gov and grants.gov. Register or see if you need to renew your accounts as soon as possible. You will submit your entire NTAP application in grants.gov. Here is the link to the application workspace. We'll go ahead and put that in the chat shortly if we're able to, as we're experiencing some technical difficulties. So thank you for bearing with us. This time around, the NTAP application has no EHBs component. This means that you will submit most of your application as attachments. Applications are due March 31st, 2026 at 11:59 p.m. Eastern Time. The page limit for your application is 80 pages. We will not review any pages over the limit, but there are a couple of things that do not count for the page limit. Ensure to check your application carefully before submitting. Apology for the difficulty. This slide lists the forms you will complete in grants.gov. For details about each form, see the application contents and format section of the NOFO. This slide lists the attachments you will upload in grants.gov, including your project work plan. A few attachments are only required if they apply to your project. For example, if you include indirect cost in your NTAP budget, you'll upload a copy of your negotiated indirect cost rate agreement. We will provide guidance on developing some of these attachments in the next few slides. The TA webpage has samples and other resources to support your application development. A major component of your application is the project narrative, which includes 7 sections: introduction, need, response, collaboration, impact, capacity, and support requested. Each section has corresponding review criteria and allotted points. The introduction is not scored, but identifies the NTAP category you are applying for. Need is worth 15 points. In this section, you will use data to describe current and anticipated health center needs related to your NTAP category. Response is divided into two sections that are each worth 15 points: the project work plan and the project narrative. In your project work plan, you will propose activities to achieve the objectives for your NTAP category. In your project narrative, you will describe how the activities you are proposing will address the issues you identified in your needs section. Collaboration, worth 10 points, is where you will describe partnerships that will support your project. Impact, worth 15 points, is where you will outline how you will measure your project success. Capacity, worth 25 points, is where you will document your ability to carry out your proposed project. Support requested, worth 5 points, is where reviewers will assess your budget for reasonableness, consistency, and alignment with your proposed plan. See the application contents and format and application review sections of the NOFO for details. You will submit your project work plan, or PWP, as an attachment in grants.gov. The PWP will not count towards the page limit. Because you are submitting your PWP as an attachment, check your formatting to make sure the format you use does not result in text that breaks oddly across pages or cuts off text. To improve readability, we recommend only using 2 columns in your PWP and formatting it to fit the width of the page and portrait layout. This may make your PWP quite long, but since these pages do not count towards your page limit, it is important to ensure that your content is easy to read. You can find a detailed description of the PWP in Appendix A of the NOFO and a sample PWP on the NTAP TA webpage. In your PWP, outline your plan to achieve the objectives for your selected NTAP category. Your PWP includes 2 sections: objectives and activities. For each objective, set a target based on the measures listed in tables 4, 5, and 6 of the NOFO. Targets should be realistic and achievable. You will also write an impact narrative describing how your proposed activities will help you achieve your objective targets. In the activities section, propose activities that you will complete in the first year of your project. You must propose at least 1 activity per objective. You may add as many activities as you need to complete your plan. Be sure to include the required number of activities, participants, and sessions for your NTAP category. Each activity should include the TA format, the performance domains connected to the activity, and the supporting partners. The SF424A is the standard budget information form. You may request up to $8 million for each year of the 4-year period of performance. In Section A, list your proposed Year 1 costs. Your application will not be eligible if you request more than $8 million in federal funding. In Section B, provide a breakdown of your Year 1 federal requests by object class category, such as personnel, contractual, and supplies. You may leave Section C and D blank. In Section E, include your federal funding request for each remaining year. Put Year 2 in the first column, Year 3 in the second column, and Year 4 in the third column. Leave the other columns blank. We expect your expenditures to be stable over the 4-year period of performance, so your request for years 2, 3, and 4 cannot exceed your year 1 request. In Section F, enter your indirect cost rate type. Your application will also include a budget narrative that details your federal costs for each year. Your budget narrative must outline all federal expenses that will support your NTAP project, broken out by object class category. For year 1, everything should align with Section B of your SF 424A. For years 2, 3, and 4, highlight any subsequent changes from year 1. Some activities and costs must vary across the years to achieve the objectives, such as bringing outcomes-focused cohort members together and conducting the National TA Needs Assessment. Make sure this variability is clear in the budget narrative. You'll also include a staff justification table for direct hire and contracted personnel. You will find a sample budget narrative and staff justification table on our technical assistance webpage. Your proposed costs must support the NTAP purpose and objectives. This slide lists ineligible costs. You cannot use NTAP funds for costs already paid by any other federal awards, propose costs for construction or minor alteration and renovation, sponsor conferences, or pay for NTAP staff professional development. Refer to the funding policies and limitations and budget narrative sections in the NOFO for a full list of ineligible costs. Now I'll share a bit about reporting requirements and other considerations. We'll keep track of how award recipients are doing through regularly scheduled check-ins and a couple of annual reports. You will submit an annual federal financial report to account for how you've spent federal funds. You'll also provide an annual non-competing continuation, or NCC, progress report. Your NCC will include progress on your PWP activities and objective targets. It will also include an updated budget and work plan for the next year. You will submit a final report at the end of your project or period of performance that will include data on meeting each of your objective targets and lessons learned. And as I mentioned earlier, your application is due in grants.gov by 11:59 p.m. Eastern Time on Tuesday, March 31st. The deadline does not vary by time zone, so please plan accordingly. We plan to make awards around the August 1 start date. Now, I'll highlight the technical assistance resources that can support you in completing and submitting your application. I mentioned the NTAP TA webpage throughout this presentation. A link is available on this slide, and we will also share it in the chat if we are able. The webpage offers helpful materials that can answer many of your application-related questions, including responses to frequently asked questions and sample documents such as the PWP and budget narrative. If you have any questions after today's presentation, please use the BIPIC contact form to contact the technical assistance team. Be sure to select National Technical Assistance Programs on the BIPIC contact form. We are happy to respond in writing or set up a call to talk through the answers to your questions. You can let us know your preference when you send your questions to us through the BIPIC contact form. If you have questions about federal funding requirements or how to complete your budget form or budget narrative, please contact Brian Feldman. For grants.gov issues, reach out to grants.gov support. As a reminder, make sure to sign up for grants.gov as soon as possible and ensure that your account is active and up to date. And this concludes our NTAP summary. We will now turn to your questions. I'm joined by Olivia Shockey, Director of Expansion in the Bureau of Primary Healthcare, as well as my colleagues Tirsa McClinton and Rebecca Levine-Heller. We are also joined by colleagues from HRSA's Division of Grants Management Operations. We are going to start by addressing some questions that we received in advance through the BitPick contact form. And I believe at this moment that the Q&A pod might be disabled, so we might not be able to get to your questions, but if you are able to send them forward through the BitPick contact form, we will be monitoring those actively during this call. And if we do not answer your questions today, then also please submit them to the technical assistance team using the BitPick contact form.
Thanks so much, Kayla.
I'll just hop on and again, thank Kayla for the presentation today. So we apologize for the technical challenges that we've had the last few weeks with some of our webinars. So we will try to use the chat, the contact form to take your questions if we can't figure out how to fix this so we can get your Q's and A's. But please be patient with us. We will do our best in the next 23 minutes or so. So did that stall enough for you all to be able to get some questions that we can answer?
All right. I'm sorry about that. We're going to start with some questions about applicant and application structure. So first we have NTAP awards are large and complex. My organization is very large. Can we apply for more than one NTAP category if different parts of my organization will lead each part? All right, Kayla, you want to help us answer this one?
Yes. So NTAP awards are large and complex as they are $8 million funding opportunities or awards. And so an organization is only allowed to submit one application, which means that your organization needs to choose which NTAP category to apply for rather than applying for both.
Can an organization receive an award in one category and serve as a subrecipient in another category?
So there are no restrictions on this, but you must ensure that you can meet your obligations under the primary award and as a recipient if both applications receive awards.
May I request less than the maximum of $8 million per year?
Yes. You may request less than the maximum funding amount of $8 million. However, you are expected to meet the minimum activities required per budget year, and then you also need to request the same amount for each year. The maximum amount was set based on the expected level of effort for achieving the expected outcomes, given the required number of objectives and activities.
And can you clarify, is the funding $8 million per year, or is it a total of $2 million per year that adds up to a total award of $8 million? Can you clarify that for us, Kayla?
Yes. It is a total of $8 million per year across the 4-year period of performance. So each year is $8 million.
How can I incorporate contracts when planning NTAP activities?
You should have in-house expertise to manage the NTAP award and also guide and support NTAP activities. You should consider the use of contracts to bring in particular subject matter expertise as well. And then contractors and partners may also carry out a portion of many of the activities and the project work plan. But your budget narrative staffing plan, and your project narrative should show how staff and contractors will work together.
I see the uniform data system mentioned in the NOFO and for some of the objectives. Can we cite data sources other than the UDS?
Yes. So for you, you are actually encouraged to use and cite all data sources relevant to health centers, technical assistance needs, in your application. In the objectives, you will see that sometimes UDS data is referenced for how progress will be measured. And so you must use UDS in those instances, but you may also consider other sources of data.
So now we're going to turn to some questions about outcomes-focused cohorts. How will I know which health centers are at or below the third quartile for selected performance measures to establish outcomes-focused cohorts?
So we will use the 2025 UDS quartile data to help you establish your outcomes-focused cohorts. And we will do this after we make the NTAP awards. So for now, your focus should be on planning cohort activities that will engage health centers for a 3-year period, as we mentioned, and then improve performance.
How can we incentivize health centers to participate in outcomes-focused cohorts?
So first, HRSA is going to help you form your outcomes-focused cohorts. You should design your cohort activities in ways that support ongoing health center participation, meet health center needs. And then additionally, you may fund health center participation in 2 in-person outcomes-focused cohorts over the period of performance, including costs for transportation, lodging, and per diem.
Can you clarify the difference between outcomes-focused cohorts and communities of practice?
Yes, so outcomes-focused cohorts are multi-year, structured, and intensive activities that can include one-on-one support. And then Jim framed these as high-effort, high-reward activities, and they have defined participants, timelines, and goals to help health centers improve in particular measures over time. Communities of practice, on the other hand, are shorter term and more flexible, and they focus on peer learning in small groups, and they may result in a wide variety of improvements.
And then we have one other question about communities of practice. Is the National TA and Coordination Center required to focus all 12 national communities of practice exclusively on health center leadership for Objective 6, which is the objective about improving health centers' leadership and governing boards?
Yes. For the National TA and Coordination Center, the 12 communities of practice for Objective 6 must focus on health center board members and executive staff. But you could choose to use COPs or communities of practice to address other objectives, such as the strategic engagement or support for health center compliance with program requirements. And then these COPs might include health center staff that are not part of the leadership teams or governing boards objectives or communities of practice.
Great, thank you so much. So we're going to turn to some more questions that we've received from the BIPIC contact form.
So while Rebecca is pulling those, this is Olivia Shockey. Sorry, y'all, you're seeing it show up as Kayla because we're having a little bit of computer issues here. But I just want to summarize a few of the themes that we're seeing in Salesforce before we get into specifics, because there are a lot of questions coming in. That is wonderful. We want you to ask your questions. We know that these are big awards with big responsibilities attached to them. So keep them coming. As I have worked with NTAP type organizations and awards before, I know you like to ask lots of multi-part questions. So know that you might not get all of your answers back from the BIPIC contact form all at once, because there might be a few that are a little bit more challenging or complex that we need to do some in-house coordination on answering. So often if you don't hear back immediately, we're checking in with grants management, we're checking in with different colleagues here. So please just know that the more complex you send your questions in, if it's a 14-parter, it might just take us a little bit longer to get back to you. So be patient with us. A lot of the questions right now are about eligibility. And so we want to stress that while you are only allowed to apply for one award, you can be included in other applications. We know that some of you are hedging your bets. You're trying to figure out how to form partnerships that will really work for the myriad of objectives that are in each of these categories. And so it's okay to propose to be part of multiple things or to apply as a primary while you're part of another application. But please make sure that if you're in different categories that way, that you can actually carry out all the things that you've put in the applications, because you put the program in a little bit of a bind if you end up getting listed in multiple awards, and then that's too much, right? So we want to make sure that if you're committing to being a contractor on multiple applications, that that's realistic for your organization if those applications get funded across the different categories. We're also getting questions about which category should I apply for? How do I think that through? Can you help me figure that out? We cannot. HRSA can't tell you what to do there. It really is an organizational decision. We want you to think very carefully about this based on your organization's strengths and capabilities, based on the partnerships that you have currently and are going to be forming as part of this application process. We need you to pay very close attention to the review criteria in the NOFO, because that is how the reviewers are going to make distinctions in applications. We have gotten a fair number of questions about how do we figure out where to go deep and where to go broad, or what are reviewers going to care the most about in this area or that area. We can't tell you those things either, right? We need you to make decisions about where to go broad and where to go deep based on your organization's capabilities, your understanding of the needs, the partnerships that you're going to form, where you think the highest needs are. And those decisions will determine how you put your application together. We can't make those decisions. So I just want to be very clear that if you've set those types of questions in and you get back from us an answer that feels like a non-answer, that's why. This is part of the merit review process, where the reviewers look at your application and the proposal that you've put together, and they assess the strengths and the areas for growth in that application. So we don't want to try to get inside of that process. So I'm going to turn it over to Rebecca, who can go through some more specific questions that we've been getting, but just wanted to make sure to share those tips with everybody, because we are seeing a lot of questions in those spaces.
Thanks so much, Olivia. So turning to the questions that we have received through the BitPick contact form so far, Kayla mentioned about formatting your application and printable areas. Can some of the attachments like the organizational chart and the staffing plan be presented in landscape mode rather than portrait mode?
Yes, so you may submit your attachments in landscape mode or portrait mode, but you need to check your print area to make sure the format you use does not result in text that breaks oddly across pages or cuts off text. And the reason for this is that the attachments will be submitted in grants.gov. Once they will be combined into a single PDF document for reviewers. So ensuring that the text is easily readable will ensure that reviewers can easily review and consider your content.
Can the participants in the communities of practice receive travel reimbursement to attend in-person community of practice meetings?
No. So communities of practice are meant to be short-term in nature, so participants may not receive reimbursement to travel to in-person meetings.
And I know we might have touched on this already, but may outcomes-focused cohorts participants receive travel reimbursement for to attend in-person cohort meetings?
Yes. So for outcomes-focused cohorts, the NOFO does describe the ability to use NTAP funding to help health centers participate in up to 2 outcomes-focused cohort meetings within the 3-year period for which you are working with the cohorts. And then travel costs may be covered. For example, airfare, along with costs related to lodging and per diem, which covers meals and also incidental costs.
Um, we've received questions about including contracts in your budget. Is there a maximum dollar amount or percentage that an applicant can budget under the contractual object class category? And we may need some support from our grants management colleagues in this one as well. So I'll turn to you, Kayla, and then we can turn things over to grants management, see if they have anything to add.
Perfect. Thank you. So you should have in-house expertise to manage the NTAP award and also guide and support NTAP activities. We encourage the use of contracts to bring subject matter expertise and carry out many activities and the project work plan. But you should describe how staff and contractors will work together in the project narrative, staffing plan, and also the budget narrative, as I previously mentioned. And so if you are contracting with individuals and they are not considered consultants, you will need to provide the number of hours projected and the hourly rate, which cannot exceed $109.62 per hour. Brian or any of our GMS specialists, if there's anything that you would like to include.
No, actually, Kayla, you covered everything. That was exactly what I was going to say.
Thank you.
So I'll just add to that we know we've asked for a wide variety of objectives to be met under each of these awards, right? So it is probably unlikely that your organization has all the staff, all the depth, all the breadth, and all the expertise to do all the things in-house. So that is not our expectation. In fact, the funding opportunity requires you to partner and requires you to provide letters of support from organizations that support your project. So we want you to think through how you can best utilize other organizations with expertise to help you meet the overall objectives in these three large categories. And I'll also point out that the work plan also asks for details about the way that you are engaging partners in each of these activities. So it's clear that we expect you to have partnerships. We have not put parameters around maximums and minimums because we know each applicant organization may have different strengths and different areas where they need to reach out. And so we need you to think through what makes the most sense for achieving these objectives to really advance the work of the health centers, right? That's the ultimate goal, to help health centers be stronger in all of the different areas that are listed in the objectives.
Thanks so much. And just to reiterate Olivia's point earlier, as she mentioned, we received a lot of questions about, can I be a subaward recipient or a contractor on multiple projects? The answer is yes, as long as you're able to fulfill the obligations of all of your commitments. If they are funded, make sure you're able to carry out meet all of your objectives. If you're the primary award recipient, or if you're a subrecipient or on a contract, that you're able to fulfill those obligations as well. So the NOFO talks about you may submit only one application. Who is the you? Does that refer to one per organization, or is that one individual like a PI who may submit an application?
So this application does not support the PI model, right? That's not what the NTAP program is about. But the U is the organization. So this is really going to take an organizational commitment to achieve the goals of this program. And the U is your organization. So I understand that some organizations are very, very large and they might have expertise in 2 out of the 3 areas. You're going to need to pick your path. So I know that feels stressful. That's one of the reasons that we have tried to provide as long of an application window as we could provide in this instance in order to still get these awards made within the fiscal year. Because we know that you need to think this through, and all of the partnerships and potential contractors or sub-awardees, it requires thought as you put your application together. So we appreciate that you're in that thinking space right now. We will help you with the questions that we can. The ones that are organizational decisions will certainly remind you of that as you ask your questions. So don't hesitate to ask. Just know that some of the decisions are really going to have to be driven by you as the applicant organization.
Thanks so much. So we've received a question about The timing that we will make awards, and just to reiterate, they will be made around the 8/1 start date. They will be made before that date. And then the awards will start on 8/1 of 2026. This is actually a question about the current award recipients, the 2023 NTAP award recipients, asking if they will receive an extension on their current awards to help meet any sort of funding gap if they receive a new award.
So let me just jump in and refocus us on the FY26 funding opportunity. Let's keep the questions focused there. If there happen to be organizations on the call that are current award recipients, please contact your project officer to discuss anything about your current award. And it looks like we might have time for maybe 1 or 2 more questions, Rebecca, if there's 1 or 2 more in the queue.
Just check it in. Kayla, you mentioned the maximum amount for, in the question we had about contracts, you mentioned the maximum salary. Could you mention that? Could you reiterate that? The hourly rate for the contracts?
Yes. So the hourly rate.
I can jump in here on that if you want.
Thanks, Brian. That's perfect.
Okay. So just so everybody is aware, the federal salary limit is equal to the current year's federal salary for the executive level 2 series of federal salaries. So if you go onto the opm.gov website and you look up the executive series salaries, look at level 2, that is always the federal salary limit. When we're talking about the hourly rate, we are talking about dividing that salary limit, which currently for 2026 is $228,000. You divide $228,000 by 2,080 hours, which is 52 weeks times 40 hours a week. And that's where you get $109.62 per hour.
That's great, Brian. And I'll actually make the last question kind of an tack on to that because we get this question a lot too. In our budget in the budget narratives, we know that the applicants should provide some details on their personnel and a table that helps us to understand that they are going to be adhering to that salary limitation. Who else belongs in that table besides direct hire staff? Because I believe it includes contractors as well. So who else goes in that table?
So direct hires and individual contractors, but not subject matter experts or consultants. Subject matter experts and consultants are exempt from that salary limit. So unless you're just contracting with somebody to maybe help out with like some sort of administrative duty or something, but is not serving as a subject matter expert, that person would be a contractor, not a consultant, and would be bound by the salary limit.
So we'll make sure to add an FAQ for everyone on that because I think it's a little bit confusing and we want to make sure that the federal dollars are well spent and are maximized. And so that's part of the reason that we ask for that level of detail. So I'm going to turn it over to Kayla to wrap us up.
Thank you. This concludes our Q&A session, so thank you so much for sending us your questions. And we know that we did not have the opportunity to answer or go through all of your questions asked today, so as a reminder, please submit your questions via the BPIC contact form, and we'll be sure to provide you with an answer. Thank you for joining us today. We encourage you to consider if this is the right opportunity for you to provide technical assistance to health centers. And Happy New Year to you all. This concludes today's call.